Morning, everyone. I'd like to echo what Dan said. Thanks for joining us today. Get to dive more into ERISA and ERISA compliance, which is I know why everybody here went into human resources and wanted to work at a company is because they said, you know what I want to do with my life is I want to get into ERISA compliance. It's a joke, obviously. I don't think I know a single person that said that. That said, I don't find it as necessarily tedious or boring as most people. I think it can be kind of exciting and interesting work trying to help companies avert problems before they begin. Like I said last week, I've been involved with some retirement plan snafus, trying to fix them on behalf of clients with dealing with the IRS. And I'm just going to reiterate, it's not fun. You don't want to do that. You want to make sure all your ducks are in a row ahead of time, so that we never have to go down that path and you never have to worry about that stress or hassle or expense of having to hire an attorney to fix problems. So last week we talked a little bit about the basics of ERISA, which again is the Employee Retirement Income and Security Act. We're going to focus mostly on health and welfare stuff today. And without further ado, let's get into it. All right. So we talked last week at the end what companies are subject to ERISA, and I neglected to include the slide about the companies who were exempt from complying with ERISA, and there's not a lot. You know, if you're a government agency, government, municipality, state, federal, local, you're going to be exempt from ERISA and ERISA requirements. And if you were a church or church plan, and there is a lot of litigation about what is an actual church plan, it is a hospital that is run by a group of sisters. Is that going to be something that is a church plan or not? And there's a lot of litigation around that, especially I know I have a friend who works at a hospital here in the Milwaukee area, and there was a bunch of litigation and a class action about that. Hopefully, if you are a church plan, you will get into that with your plan designer to make sure that you have that covered ahead of time. The second exceptions that we're talking about here are programs that are maintained solely to comply with state law requirements. So if you have to have work comp insurance, that's going to be something that's going to be exempt from ERISA and the ERISA reporting requirements that we're going to talk about in a little bit. Unemployment compensation, you have to pay the state and federal government, SUTA and FUTA. Those programs are going to be exempt from ERISA. Disability plans, short-term, long-term, those are exempt from ERISA generally, and plans maintained outside the US. Obviously, if you have employees working in Britain or China or Russia or wherever they're working as permanent residents or citizens, US law is not going to attach to those employees that are working overseas, or even, I guess, just north or south of the border. And along with that, so we talked about who's covered and who's exempt, and pretty much we've determined that every single private company is pretty much going to be covered by ERISA. So why are so many employers out of compliance with ERISA? Number one, companies just don't know what they're supposed to do or not supposed to do. So they don't understand. There's confusion in the marketplace about what they have to do. The second thing we talked about, like with retirement plans last week, retirement plans, your TPA sends you documents or sends out documents to make sure that you're in compliance with ERISA on the retirement side. So a lot of companies presume that what you get on the health and welfare side is deemed to be sufficient for you to comply with ERISA. Not so. A lot of companies I've seen would just send out the certificate of insurance and think that's enough, and it isn't. There's confusion just because the regulations are a mess. I don't know how many of you have taken, a leisurely stroll through the Internal Revenue Code. I suppose if you have insomnia, I highly recommend it. If you are looking for leisure reading or a good beach book, I recommend against it. It's confusing. There's a lot of cross-referencing. Not only is there the code, and then there's regs, and it's a whole bunch of nonsense that you have to go through in order to figure out what the IRS is talking about. In fact, I had a tax professor back in law school last century, actually no, it was this century, that said, you know, when you want to figure out what the IRS is saying, go to a secondary source that interprets the code first and figure that out. And then if you still can't figure it out, then you look at the actual code, because it's that arcane. So it's not surprising to me that companies don't understand the regulations because they're not for the faint of heart to read. It's a complex law, even for those of us who deal with it on a routine and regular basis. And in the past, there had been limited enforcement actions. In fact, I remember I called about 10 years ago, I called the DOL EBSA to try to figure out if I could get some numbers in terms of what kind of enforcement actions they had taken and stuff like that. And they kind of laughed at me. They're basically like, we don't keep track of that. But with the regime, and with things taking a more employee-friendly tone in Washington, and with, like I mentioned last week, the sharing of information between the DOL and the IRS and the NLRB and all those agencies, you're going to see, and I think we have been seeing some more enforcement in terms of ERISA compliance. So back to the basics. What is required to comply with ERISA? I think I mentioned this briefly last week, but you're going to need a plan document, number one. This plan document tells everyone what the rules of the plan are. It's basically, you can think of it as contract. You can think of it, if you're in kindergarten, classroom rules. These are the rules for being in this classroom. You got to raise your hand. You got to, X, Y, Z. ERISA states that every plan has to have a plan document that states what the rules of the plan are, who's covered, who's eligible, when does coverage start, what do you do to gain eligibility, all these sorts of fun things. And those are all contained in the plan document. And the plan document is something that isn't necessarily distributed to employees routinely. They can request a copy of the plan document. I think we'll get into that. But it's just something that basically sets the rules for the plan. If you don't know who's eligible, how do you know when to offer someone coverage or when to not offer someone coverage? So these are the cornerstone. These are the bedrock. This is the foundation of your plan, is the plan documents. While an ERISA plan can exist without a plan document, that basically it says even if you have a plan but you don't have a plan document, it doesn't mean you evade ERISA. Now, you can't say, well, I'm not in ERISA plan because I don't have a plan document. The DOL is not going to fall for that one. They're going to say you are an ERISA plan and now we're going to ding you twice because you're out of compliance because you don't have a written document. So make sure that there's a plan document. There generally is, and that's generally started right away when you start the plan. Make sure it's up to date. Make sure it's been amended to change whatever changes that have needed to occur over the years. If you're pre-Affordable Care Act, make sure that your eligibility requirements reflect the Affordable Care Act requirements if you are subject to them. And there's different types of documents in terms of different type of benefits. And self-insured plans are going to be way different than fully insured plans, because fully insured plans, you don't handle money, you don't handle claims. Those all are handled by the insurance company or TPA. And so if you're handling your own claims and stuff like that, your document is going to be much more complex than you would find with a fully insured plan, or sometimes called non-funded plans. So we talked a little bit about reporting requirements. I laid that out there, and we just talked that you have to have a plan document for each plan. And the plan terms are important. So just because you have a plan document doesn't mean you can go willy-nilly and do whatever you want and make interpretations on terms of who gets coverage and who doesn't. Um, the rules in the plan document are the rules. And if you don't want to follow those rules, you need to update your plan document to change it, or else you're going to get hammered if the IRS or the DOL ever does an audit, or if you ever seek or are faced with an ERISA suit. So the plan document, again, is your Bible. That's what you go by day in, day out. Those are your cardinal rules. Fidelity bonds, these are more for self-insured plans, self-funded plans. So if you maintain a pot of money that pay claims as they come in, and you have money, or in an FSA where employees deposit money for spending in the future, either for dependent care or most likely for health care, you need an ERISA bond. It's not enough to have errors and omissions insurance for the company or for the directors. You need a bond. Most plans, however, are fully insured. So like if you have Blue Cross Blue Shield, that's going to be a fully insured non-funded plan, and a bond wouldn't be required. The key trick is if there's a pot of money that you're holding for employees somewhere that they can draw out of, that's going to be a plan where you're going to need a fidelity bond. Summary plan descriptions, we're going to talk about that, I think, on the next slide, or one or two ahead of us. And those have to be furnished automatically to all plan participants. Those are something that's a key issue that employers usually miss. And we'll talk a little bit about SPDs. And an SMM needs to be furnished to plan participants when you change the terms and conditions of the plan. So if you do have a plan document, which you should, if a participant or beneficiary requests a copy of the plan document, you must provide that copy to the requester. Each year, if you have 100 or more participants on the first day of the plan year, you get the benefit of having to file a Form 5500 annually with the IRS. And I believe that due date is in July every year. It's so many days from the end of the plan year. And that 5500 basically just states a bunch of information the IRS wants to know about commissions and plans and premiums and stuff like that. So that is something in addition to the plan document and the SPD that you get to hand out. And finally, there's a summary annual report that goes out every year. The summary annual report basically is the Cliff Notes version of the 5500. You have to furnish that automatically to plan participants if you have to file 5500. And this is an exception for totally unfunded welfare plans. So there are some exceptions for that, but they don't come up very often. Just a little bit more about summary plan description. What's in it, what is it? It's a document that is written so that participants of the plan can understand it. At least that's what the rules say. I've never seen, at least I don't think I've seen a court case say that this SPD is too impossible to understand and we're not going to allow it. I don't think I've come across that yet. But basically, it's a summary of the plan document. Just like the summary annual report is a summary of the 5500, the SPD is a summary of the plan doc. And it's going to tell you who the plan administrator is, what their duties and requirements are. It's going to tell you how the plan works, who is eligible for benefits, how you enroll, how you file claims. And generally what I throw in there, like I said, is a list of required notices. There's annual notices that are required under ERISA, under the Women's Health and Cancer Act, and CHIP notices and whatnot, mental health notices are required under federal law, and I usually throw those in the SPD to cover the bases, so we can just send out one document and be done with it. Distribution of these, you should do it every 90 days, or I'm sorry, not every 90 days, that'd be ridiculous. Within 90 days of when the participant first enrolls in coverage. New plans, if it's a brand new plan that never existed before, that 90 days gets extended to 120 days. The SPD is good theoretically for 10 years. If you don't make any changes. You should still distribute it, probably annually during open enrollment is my suggestion. But you don't have to update it unless you've made changes. If you've made changes, you theoretically only have to update and include an SMM, which is a summary of material modifications. But my recommendation is to just update your SPD annually because you're going to need it for new employees, and you have to figure out, do I have all the right attachments? Did I forget an SMM? It's a headache, and instead, just when you make changes, just get a new SPD. It's so much easier. In terms of furnishing them, there's a fun IRS language that says it has to be reasonably calculated to ensure actual receipt of the material using a method likely to result in full distribution, which in English to me means nothing. But in translated words, basically you can hand it to your employees, you can mail them a paper copy. If they are a computer worker under the IRS and the safe harbor rules, you can email them a copy. And potentially you can deliver it through an electronic delivery benefits site, either through like your payroll, or if you have a benefits site that provides links or has copies of documents. There are tricks to that. A lot of times you have to get buy-in and what's the word I'm looking for? An authorization from the employee, especially if they were not a computer employee, like if they're in the field as a plumber fixing sinks and toilets and whatnot all day, they're not going to have access to a computer under the safe harbor rules. And so you're going to have to get their permission to distribute it electronically, unlike you would with a desk worker. One important thing to note about that is I do remember a case, is a life insurance case, I think it was Guardian, but anyways, out of New York State, where there are rules about how you had to pay your premiums, and that was all included in the summary plan description, and they just emailed it to employees, but they didn't follow the proper steps in order to do that. One of their employees became terminally ill. They missed their voluntary premium, and as such, the plan was canceled. The life insurance contract was canceled for that employee. That employee subsequently passed away, and one of their heirs, beneficiaries, sued the company and said, hey, you didn't follow the ERISA rules in terms of distribution of the summary plan description, so my loved one didn't know that the plan would lapse after so many non-paid premiums, and as such, that life insurance policy should still be in effect, and I should get my $1 million. And the company lost, and the beneficiary walked away with a bunch of money, and the company was left holding the bag because the insurance company said we were never paid premiums, so there's no policy active, and so the company had to fork out the money that would have been handed over by the insurance company had the employee actually paid the benefits, but they didn't know about the benefits because the summary plan description wasn't distributed properly. So that's a lot to say that it's important to make sure you're doing this right, make sure that you have these documents, make sure that you're distributing them according to the rules. Next week, we're going to finish up our talk about ERISA. So join us again Wednesday, 11 o'clock on the 27th of March. Once again, we'll be guiding you through the wonderful world of ERISA. Thanks for joining us today.